Okay, today we are jumping into a huge breakthrough fresh from the New England Journal of Medicine. It's all about a brand new weapon against one of the most aggressive lung cancers out there. And honestly, it could change everything for patients who have been running out of options. Let's get into why this is such a massive deal.
So to really get why this is such a game changer, you have to understand the opponent we're dealing with. We're talking about extensive stage small cell lung cancer, or SCLC. For these patients, the 5-year survival rate has been just shockingly low, less than 5%. It's an unbelievably tough fight.
And you know, for patients whose cancer comes back after that first round of treatment, the situation has been even more bleak. For 3 whole decades, the standard options have offered very little hope. Progress just stalled, and that long, frustrating wait is really the backdrop for the story we're about to tell.
So what is it that makes SCLC so incredibly tough? Well, while it often responds pretty well to the first round of chemotherapy, this cancer is just relentless. It almost always finds a way back, and when it does, it's usually angrier and resistant to treatment, leaving doctors and patients in a really difficult spot.
When you put all these challenges together, it's a pretty grim picture. The cancer is aggressive, it loves to relapse, and the standard chemo that we've been using gives patients, on average, only about 7 to 9 more months of life, and it comes with some truly debilitating side effects. That's the mountain a new treatment has to climb.
But now, enter Tarlatamab. This is not just another chemotherapy drug. Not at all. This represents a completely different way of thinking about fighting cancer. Instead of poisoning the cancer cells, this is about teaching your body's own immune system how to hunt them down and take them out.
Tarlatamab is something called a bispecific T-cell engager, or a BiTE for short. The easiest way to picture it is like a microscopic bridge, or maybe a matchmaker. It's a tiny molecule that's engineered to do one very clever job: physically grab one of your immune system's killer T cells and connect it directly to a cancer cell.
Think of it as a cellular matchmaker. Here's how it works. First, one end of this little molecule finds a protein called DLL3, which is like a flag sticking out on almost every SCLC tumor cell. At the exact same time, the other end grabs onto a nearby T cell. By literally yanking them together, it forces the T cell to wake up, recognize the cancer as an enemy, and destroy it. It's a brilliant way to unmask the cancer that's trying to hide.
So look, the idea is genius, right? But the billion-dollar question is, does it actually work better than the old standard of care? To figure that out, researchers set up the Delphi 304 clinical trial. This was it, the ultimate head-to-head showdown.
And the way they designed it was simple but really powerful. They took 509 patients whose cancer had come back and randomly split them right down the middle. Half got Tarlatamab, the new drug, the other half got the standard chemotherapy. A straight-up fair fight.
And I really want to stress this was not some easy patient population. Far from it. Over 70% had already been on other immunotherapies. Almost half of them had cancer that had spread to the brain, and another 44% had platinum-resistant disease, which basically means the strongest chemos had stopped working for them. These are some of the toughest cases in all of oncology.
So that set up the ultimate question, right? In this incredibly difficult-to-treat group, who was going to win? The decades-old standard chemotherapy or this brand-new immune engineering drug? And the results, which were published in July of 2025, weren't just a little promising, they were a knockout. Tarlatamab scored a clear, decisive victory. So let's break down exactly what they found.
Okay, so when you're looking at a trial like this, there's one metric that really matters more than anything else. It's called overall survival. It's the bottom line. It's the simplest question. Which one helps people live longer?
And the answer was a huge, resounding yes. The median overall survival for patients on Tarlatamab was 13.6 months. For chemo, just 8.3 months. That is over 5 additional months of life. For this disease, that is a massive, clinically meaningful win.
But living longer is only half the battle, right? The quality of that time is just as important. So what about the side effects? How did these two treatments stack up against each other?
This is where the story gets just as compelling. We're looking at what are called severe side effects, the really tough ones that can put you in the hospital. For patients on chemotherapy, a staggering 80% had to deal with these. But with Tarlatamab, that number dropped all the way down to 54%. That's a night and day difference in what patients have to go through.
I mean, this study's own abstract says it all, plain as day. They concluded that treatment with tarlatamab led to longer survival and had fewer severe side effects. It's a clear win on the two fronts that matter most. It works better and it's easier on the patient.
And the good news just kept coming. Far fewer patients on tarlatamab had to stop treatment because the side effects were too much. The patients themselves actually reported feeling better, less shortness of breath, less coughing, and maybe most importantly, when the new drug worked, it kept working for much, much longer.
So when you start to put all these pieces together, you can really see why people aren't just calling this an improvement. They're calling it a landmark.
And that's not just my opinion. The authors themselves, writing in one of the most prestigious medical journals on the planet, used that exact phrase. They called this a landmark trial that represents an important advance. You know, scientists do not throw words like that around lightly.
This timeline really puts it all into perspective. You've got decades of just stagnation. Then, in 2024, the FDA gives it an early thumbs up, based on promising data. Now, this trial confirms that promise, cementing its place as the new standard of care, and it's already opening the door to see if it can work even earlier in the disease.
And that is really the whole story right there. If you take one thing away, it's this. For a community that has been waiting for 30 years, we finally have a therapy that doesn't just offer more time, but it offers better time. It's a real shift away from the sledgehammer of chemo to the smart bomb of immunotherapy.
And that leaves us with this final, really hopeful thought. This trial proves the concept works. We can teach our own immune system to hunt down and kill one of the deadliest cancers we know of. So if we can do it for small cell lung cancer, what other tough cancers are next?